Hello, my name is Ashwin Kulkarni and I work in Leicester. My patients often ask me, how do you do SuperPATH hip replacement? So here is the explanation. First, we template the hip x-rays so we know exactly what we're going to put and where we're going to put it. And then after anesthetic, the patient is lying on their side. This is a common position for most hip replacements. And here, with the patient on the side, the hip is flexed and kept as is shown in this picture, and that makes most of the muscles around hip parallel to each other. So we make a small incision about 2 inches just above the hip, and then we go and spread the muscles away. So you can see, as in the picture A, you can see the capsule of the hip and muscles put away on either side. And then the capsule is divided in picture B to expose the hip. Once you are there, you can see the femur and you're getting an entry into the femur and then making a slot to put the trial hip replacement implant. It's also called rasp. And then the rasp, once you're happy where it should be, is used, the face of the rasp, to cut the neck, and then a pin is put into the head of the femur and removed. So in this whole process, we're not disturbing the soft tissues and hip is not dislocated. Then we have a preparation through a smaller incision behind the femur with a PATH cannula that goes into the hip through a separate incision, and using this cannula, then you are using the what we call acetabular reamers to remove a bit of cartilage and bone and create a perfect hemisphere. It is also through this cannula and the incision you can insert the actual artificial socket implant, and it's hammered into the place, as you can see in this picture. Followed by that, you put a trial implant neck into the stem, which was already put in the femur, and it's put together to make sure that it is correct for length, offset, rotation, and stability. Once you're happy with it, you remove the trial ones and introduce the real implant into the femur bone called stem, and then real head, and put it together to give you the actual hip replacement. And that's the procedure of SuperPATH done. And then the wound is closed, and typically the wound is small, size of an index finger, or here you can see the biro, and it's the size of the cap of the biro. And that's the hip replacement explained through SuperPATH technique. Thank you.